Have you started to notice memory changes in someone you love and you're wondering, is this just normal aging or something more serious? You're not alone. Most people don't know the difference between typical brain changes and early warning signs of dementia. By the end of this video, you'll understand what's happening in the brain and how to spot the signs to tell when something is not normal. Hi, I'm Andrea Bendig, a dementia nurse and care consultant. Let's take a closer look at what happens to the brain as we age, starting with what's considered normal. Did you know that the brain actually starts to shrink? It's also called atrophy. In our 30s and 40s, most people find that shocking. But it's subtle at first, and by the time we reach our 60s, the atrophy increases and the brain's processing speeds slow down. The connections between brain cells, which are called neurons, may not work quickly, but most people can still function independently. They may take longer to recall a name or need to make a list to stay organized, but they're still able to manage daily life on their own. And that's normal aging. Now, let's take a look at abnormal changes. This kind of aging goes beyond natural atrophy. There is increased shrinkage and the presence of things like amyloid plaques, tau tangles, or Lewy bodies in the brain. These changes disrupt communication between the neurons and eventually the brain cells die. And unlike normal aging, this does affect a person's ability to complete everyday tasks. They might get confused about where they are, forget how to use common appliances, or struggle with dressing, hygiene, or managing money. Let's take a look at a few examples here of normal and abnormal. So normal would be retraces steps to find misplaced phone. Abnormal would be unable to locate the phone. Normal gets lost momentarily in unfamiliar places. Abnormal gets lost in familiar places. Normal writes reminders for important tasks. Abnormal writes reminders for daily activities. Normal, no falls. Abnormal, repeated falls. Normal plans a party but at a slower pace. Abnormal, unable to plan events. Normal selects clothes based on weather. Abnormal dresses inappropriately for the weather. Normal, some difficulty remembering names. Abnormal often has difficulty finding the right words. Normal, someone who is well groomed. Abnormal, someone who is lacking in hygiene. Normal, reads and comprehends well. Abnormal is no longer interested in reading. Normal occasionally repeats a question. Abnormal, repetitive questioning. So what exactly is dementia? Dementia is not one specific disease. It's a group of symptoms that interfere with a person's ability to live independently. These symptoms include forgetfulness, memory loss, difficulty with problem solving, personality changes, poor judgment, short attention span, or language and communication problems. There are many types of dementia. Some actually say there are over 100 types, but some of the most common include Alzheimer's disease, vascular dementia, Lewy body dementia, and frontotemporal dementia. All of the irreversible dementias have a progressive decline in level of functioning. Let's take a peek inside the brain. Here you can see different areas of the brain have different functions. In dementia, the parts of the brain responsible for memory, judgment, language, and emotion begin to break down. That includes areas like the hippocampus, frontal lobes, and temporal lobes. As these areas shrink and neurons die, you begin to see changes in thinking, personality, and behavior. One way I like to explain this is with an analogy I call the house of fading lights. Imagine the brain as a house filled with rooms. Each room has a light that represents a certain skill or memory. In normal aging, maybe the lights flicker occasionally, it takes a little longer to recall something, but the connection is still there. In dementia, the lights begin to dim and the lights eventually go out one by one. So consider this example. First, the attic where short-term memory lives dims. Then the kitchen that holds daily routines such as cooking becomes dark. Eventually, even the bathroom and bedroom lights fade. Things like hygiene, recognizing family members, and basic body functions are affected. And here's the key difference. You can't just flip the lights back on. The wiring, those neurons, are no longer working. If this video helped you understand the difference between normal aging and dementia, please like this video and subscribe to my channel. Stay tuned for more insights, tips, and support for dementia caregivers. Thanks so much for watching, and I will see you in the next video.